Well, talking about a new normal and countries living with it, Singapore is now preparing a strategy to live with coronavirus, treating it like a flu. Soon, residents will be free to work, travel and shop without being subjected to quarantines or lockdowns, even if the virus is around. In fact, according to three co-chairmen of the government's task force, it's an interministerial task force on coronavirus. According to them, the plans for Singapore is to adopt a new normal. COVID will be treated like any other endemic diseases such as common flu. The ministers also noted that if supplies allow, the government's next goal will be to have at least 2/3 of the population fully vaccinated with 2 doses by National Day. That's on the 9th of August. And then they will start lifting all these measures, all these restrictions that have been in place. Well, to talk more about this, we're joined by Professor Dale Fisher, Senior Consultant, Infectious Diseases, National University, Singapore Hospital. Thank you so much for joining us on the program. If you could tell us about this new strategy that Singapore is planning to adopt, hopefully after August.
I think every country will have to establish a strategy for transitioning, especially as you get more vaccinated. You see, for the last year and a half now, everyone has been doing everything possible to prevent transmission, whether it's lockdowns or mask wearing or no travelling. So now we have to work out, as we get more vaccinated, how can we ease some of those restrictions? Because obviously, there's restrictions now, and in the future state, then the vast majority of those restrictions will be gone. So it's really about how you lift the travel and the social restrictions and rely on vaccination and the public health system of quarantining and contact tracing and testing and all these types of things. We want to rely on vaccination and the public health system and start easing those travel and social restrictions, which are so harmful both socially and economically.
Right. So what would living with the virus really be like? What would this entail? And this comes at a time when we're seeing variants emerging in other parts of Asia.
Well, the vast majority of Singaporeans have been very loyal to the cause. They've really stuck by the measures because they appreciated the importance of the community in fighting transmission. So actually, in Singapore, people are desperate to get on a plane and travel and go and have a holiday, see loved ones overseas. They're very keen on getting back to mass gatherings. Up until recently, you could only have 2 people visiting your home at a time, and that's about to go back up to 5. So we're really looking forward to all these measures coming off. Of course, some people are a little bit wary, but you know, we've been waiting for so long for the vaccine to lead us out of this pandemic, and we have to trust the science and step by step let the vaccine lead us out of this pandemic.
Right. So, Professor Fisher, if you could share with us, what is the situation in Singapore like in terms of infections currently? I know the numbers are nothing like, of course, here in India, but even so, what is it like currently?
Yeah, well, we did have some recent introductions of the Delta variant. I don't really feel comfortable telling you our numbers when I'm speaking to India, but our numbers are very low. We're single digits in the country now. I think just 2, 3, 5 cases in the last few days. This is a country of 5.8 million. So at our peak, we got up to 30 cases a day over the last month, and that was across 48 clusters. Though most of those clusters have closed off now. We're now down to about 20 active cases, active clusters. Sorry. So we have good control. So really, it's about removing the restrictions and relying more on the vaccines, and that's what the strategy is all about.
All right, relying on the science, relying on the vaccines. You've been vaccinating children as well, and what has that experience been like, and how much have you managed to cover in terms of vaccinating children?
Yeah, we started doing that a couple of weeks ago. I'm not sure of the numbers, but it's around 60%, I believe, have now had their first jab. They'll be coming up for their second jabs over the next month. There's good uptake. There's popularity with it for many reasons. People want to be protected against COVID, but they also want to see the restrictions left. We've unfortunately had, I think, 12 cases of myocarditis and pericarditis, and this has been seen internationally as well across the world with the mRNA vaccines. So we recently had someone with a cardiac arrest, a teenager, after he was doing strenuous exercise. So what we've now put out in the guideline is that once a young, particularly a young male, has had an mRNA vaccine, then they really shouldn't do any strenuous exercise for the next week. All these inflammations are self-limiting. They go away after a few days, but obviously if there's unrecognized inflammation and strenuous exercise, then that can cause cardiac troubles. So we're being very transparent and sharing information publicly, and I think that's helping public confidence.
All right, well, thank you so much, Professor Fisher, for joining us on the show, and it will be very interesting to watch Singapore's example going forward.